This program is brought to you by the Forbes-featured Freedom Hub Health Plan, the alternative to overpriced and restrictive insurance. The Freedom Hub Health Plan is exactly what you need. By Frequency Medicine Associates, supporting health professionals and laypersons with safe and effective advanced telemedicine-like technology that can scan and help rebalance the root causes of stress and illness. By the Planet Lockdown film, which can be seen on the Freedom Hub's Rumble channel along with many great speakers. And by The Pavilion, a 21st century community hub that brings together many of the disruptive innovations featured by the Freedom Hub, including direct pay healthcare, farm-to-table dining, TED-like Freedom Hub talks, and more. Visit your-mp.com/pavilion solution for details. Okay, welcome to another episode of Health, Biz, and Politics. So let me first direct you to, if I could do a screen share, to our website here. So to find out about our weekly webinars, who we have coming, you can go to your-mp.com, your marketplace for health, wealth, and freedom, and just go down to webinars under the home tab, and you will see who's coming up, learn a little about them, who's coming up next week. And I'm not sure if that's correct, and Jeff, you can fill me in later. So let me get back to.
Forgot to mention at the very bottom of the links to where we archive all the videos.
Thank you. Down here we have all the BitChute, Brighteon, YouTube, Rumble, where you can find our past guests. Reach out to some of them. There are some pages here on the website, and go from there. But actually look around, there's some good things here. And we're starting to populate the partners marketplace with some of our guests, medical practices and things like that, that are in this field of disruption and innovation. So with that, let's talk about today's guest. Let me introduce. We have Lucien, who goes by Lou Morin. He's the CEO of Savvos Health out there in Utah. Welcome, Lou.
Thank you.
Lou is going to tell us about medical cost sharing, some of the things they're doing, how you can save big bucks, and really, Lou, how can we improve our healthcare system?
Wow, that's a loaded question, and I think it's a broad answer. At Savvos, we have a very unique perspective with where I think we impact the majority of the dollars that we're spending in healthcare. Now, we're not a healthcare sharing solution or anything. We are immediate cash pay settlement. I'll talk about that in our platform. But when you look at who's really moving the needle in healthcare, I do think some of these healthcare sharing ministries and whatnot, excuse me, are having a huge impact. But whether it's creative products or groups like you, or what we're doing at Savvos, or just what we're seeing in terms of tech and transparency in healthcare, I'm a big fan of everything. I'm a big fan of everybody that's on here, because I think looking ahead to the next 20 or 30 years, I really think how we deal with healthcare in the United States is one of the most defining issues for the rising generation. I really think we've got to figure out how to connect consumers with real solutions in healthcare. And I think one of the reasons why we having such a big problem is because we need to start shifting the conversation in the right direction. And to frame what we're doing at Savvos and what I mean by shifting the conversation, let me just kind of put this in context, thinking back to an experience of a few years ago. I remember during our last presidential election, and please know this is not a political commentary, but I remember there was a lot of debate and discussion around healthcare. In the presidential primary debates, and really in that whole process, healthcare rose to the top in terms of discussion items. But I took away two really important points from what I watched nationally. Is number one, we weren't debating healthcare at all. We were debating health insurance. The conversation centered around how do we pay for healthcare? And I think it's important as consumers, we really frame these conversations within the right context. We tend to combine healthcare and health insurance in the same conversation. And these are two very different conversations. A discussion around how we pay for our medical care has nothing to do with our medical care. Healthcare in and of itself is a very different conversation than funding mechanisms. And I just think that's interesting how we've sort of combined those conversations. But what was really interesting about the conversation around the election time was where the conversation went. And if you remember, what were we talking about? We were talking about, oh my gosh, how do we pay these expensive medical bills? And from my perspective, individually and at Savvos, that's not the conversation. The crisis in healthcare doesn't center around, gee, how do we pay the bill? But rather the conversation should start with, why is the bill so expensive to begin with? And when we start framing the conversation correctly, everything changes in terms of outcomes in healthcare. And like I said, this is not a political perspective. I think whether you're more conservative leaning and you're looking for a free market solution, or whether you're more progressive and you want more of a single payer system, either system fails miserably if we don't get to the heart of the problem. And the heart of the problem is, why are healthcare costs out of control? And the reality is what we need in this country is not transformative policy change or new regulations. We just need to start having the right conversation. We just need to start identifying the real problem in healthcare. And when you start looking at the landscape in healthcare, the crisis centers around out of control costs, plain and simple. But it's important to, I think, to understand what's happening in terms of healthcare. There's a very shifting relationship between patients and payers and providers when it comes to connecting with paying solutions and connecting with providers when it comes to consuming healthcare. I mean, you look at it from a patient perspective. There's never been a time in healthcare where consumers were seeing this mass migration away from traditional legacy systems to creative alternatives with third-party payers. These are member-driven solutions. These are member-incentivized solutions. So we're stepping away from, I got to stay in network. I'm trying to find a contracted provider, right? Like the whole conversation is starting to shift. And this is impacting millions of consumers across the country. And you can get a feel for what's happening by talking to kind of the frontline people when it comes to product sales. I remember 3 or 4 years ago, if you pulled a bunch of brokers together and you said, hey, what do you do for insurance for your family? Every single one of them would say, well, I have Blue Cross, I have United Healthcare, I have, Cigna. And if you talked about these alternative solutions like health sharing or what have you, they would look at you in disgust and say, oh, that's voodoo, that's fringe solutions, right? Like you didn't see a lot of that. A few months ago, I had a group of brokers sitting in my office, and I looked at each one of them and I said, what do you do for your family when it comes to insurance protection? Every single one without fail was on a health sharing plan. Isn't that interesting what's happening in the market? So we're seeing a huge migration to alternative solutions. And you look at that from a payer perspective, look at what's happening on the scene. We're seeing what I call this explosion in the emerging market of alternative payers, whether that's creative insurance companies, whether that's the health sharing community, or to be honest with you, if it's just people that are deciding to go cash pay, we're seeing this explosion in creative ways to cover our families and protect against, unexpected claims. I have a buddy who is a hotshot executive at Cigna, and we had lunch a few months ago, and he looked at me and he said, Lou, let me tell you what keeps me up at night. And it's not the ACA, it's not federal regulation, it's not the No Surprise Billing Act or anything like that. It's all these creative insurance plans and alternative payers that are stealing away our market share like crazy. So it's important, I think, for us to understand that. And when you look at what's happening on the provider side, when you look at the supply side of healthcare, there's never been as much interest as there is today in playing in the cash pay space. We're seeing that. And in fact, when you look at the studies, ambulatory surgical centers, imaging centers, diagnostic facilities like endoscopy centers, when they look at the data, if they go cash pay, their volume increases dramatically, profitability goes up by as much as 50%. So my point is, maybe I'm belaboring my intro here, but the reality is you guys, this is a shifting landscape. More than ever before, we're seeing a huge migration away from legacy systems, legacy plans to something different. And when we move into that kind of a market, what consumers need is they need better tools, they need better solutions, and that's where Savvos really sits in terms of healthcare. We are immediate cash pay settlement for elective outpatient care. Now, this is important because when you look at a healthcare population, and you look at every dollar spent within that population, well over 50%, I would say more like 60 to 70% of every dollar that we spend is spent on elective outpatient care. This is the crisis where we're spending most of our money, whether you're self-pay, whether you're with a creative insurance product, or you're with a health sharing solution. We're going to spend most of our money in elective outpatient care. And so we need consumers to connect with tools that are going to help them identify affordability. In a market where it's member driven, member incentives, we've got to start connecting consumers with the right tools. And cash pay settlement, I promise you, I know in the intro we talked about bundled cash pricing, but I think it's even more than bundling pricing. It's immediate settlement to providers, which changes the entire landscape in healthcare. When you look at this, what I call the continuum of affordability, when we start looking at health plans and how they try to control costs, you kind of start with maybe your safety net network. They're going to rent this garbage network with Cigna or Aetna or whatever. And then there's always this tier 2 buy up to your skinny network where you can't go anywhere, but your benefits are better, right? But then you kind of move across this continuum, right? You get into direct contracting and then you get into reference-based pricing, or what I affectionately call healthcare hostage negotiations. But as you move across this continuum, you start, like you benchmark against Medicare, and you might be 300 to 400% of Medicare, down to 300 to 250 to 200. But in cash pay settlement, we start getting into pricing that's sub Medicare. We get into 80% of Medicare, 90% of Medicare, 100% of Medicare. In terms of, not that I think Medicare is a great benchmark. In fact, in terms of a standard of affordability, I think Medicare is terrible. But it's a familiar benchmark, right? Like when we put it in the context of Medicare, people understand what we're talking about. But when you start looking at how do we connect our members with affordable pricing, everything changes in cash pay settlement. And so when we talk about transparency, I hate the term transparency. I think it's been overused and it's come to mean nothing in healthcare, because what we've done is we've just dumped a ton of data onto consumers, useless data that they can't do anything. It's like, hey, here's a ton of data. Look at how bad healthcare is. What consumers need is not useless data. What consumers need is to connect with solutions in the cash pay settlement space. So I think I'm sharing my screen. Does everybody see that? I got a nod there. Okay. Sorry for the pause drinking there. My throat's a little hoarse this morning. So Savvos, we work with primarily alternative third-party payers, creative insurance plans, health sharing plans. If you got a self-funded organization that's got provisions within their summary plan description for cash pay carve-outs, that's where Savvos is going to play all day. We're going to drive solutions there. And whether these solutions are used at the member advocacy level or at the member level, it's a similar experience for us. If I'm looking for, in my local market, an ACL repair, just make sure I didn't get logged out of my system here. If I'm looking for an ACL repair in my local market, what Savvos does is we make it really simple for a member, number one, to see all these, what I call sibling CPT codes. But if I want to drill down specifically into an ACL repair, what we're going to help members do in a local market is just connect with affordable cash bundles. And it's interesting. So the point I was making earlier was there's a lot of swindling going on in healthcare when it comes to transparency and cash pricing. And let me tell you what I mean by that. We had a member through Savvos that was having a cervical disc replacement surgery in Boulder, Colorado. The local hospital said, our standard price is $85,000, which is just a number they pull out of thin air. But if you pay cash today, we're going to discount that price to $40,000. And on the surface, oftentimes health plan and members, they kind of chalk that up as a win. They're like, oh my gosh, I just got 50% off. I better jump on that. But the reality is, for that member, we had a solution 10 minutes away for $12,500. We did an ovarian cyst surgery through Savvos. This was probably 2 months ago. I think it was in Florida. The local hospital, you guys, this will blow your mind. The local hospital said, our standard price is $117,000. If you pay cash up front, then we're going to discount that for you to $60,000. Right around the corner, there's an amazing facility, $6,500 for that exact same procedure. Just yesterday, we were directing a member within Savvos to an endoscopy with a biopsy. And they want to stay at the local hospital. Do you know the local hospital bills 17 grand facility charge for that endoscopy? We have a solution in that market for $1,700. So when you talk about cash pay settlement, it's not an exaggeration when I tell you that we end up reducing costs in a member-driven environment 60%, 70%, 80%, 90%. You guys, it is insane what's happening out there in terms of volatility and pricing. And I would add to that the volatility in healthcare, it's a crisis of geography. It's usually never the surgeon. It's usually never the anesthesiologist. The crisis in healthcare is, where am I going to have my surgery? I can use my same surgeon and go to this hospital or this surgical center, and it goes from 100 grand to 9 grand. That's the issue in healthcare. We need to start holding these providers accountable. So when you look at our system, we're talking about comparing cash pricing, not just with competitors in the local market, but hopefully you can see it's kind of small. We also benchmark against Medicare. And look at some of these cash prices. Guys, this is a live demo in my platform. Salt Lake Surgical is 91% of Medicare. St. George is 96. Epic is 99. Point is 143. And there may be reasons you may still want to go to Point. For an ACL repair, for Savvos, it's not about a race to the bottom. It's about what I call this range of affordability, right? Like, you might be $9,000 to $12,000 for this procedure. Great. We're not trying to connect you with the bare bones, cheapest provider. Maybe you have a surgeon that you prefer and they only operate at Point, or maybe Epic Surgical is right around the corner from your house, whatever the case may be. But what we're doing is we're taking these prices and we're saying, okay, in comparison to $80,000, $50,000, $40,000, we need to throw away all that garbage and get people connected with affordable pricing. And you're only going to really do this, folks, in cash pay settlement. I mean, you're taking baby steps with direct contracts and whatnot, but when you can go immediate cash pay settlement, the entire landscape changes. But when we're talking about cash payment with a third-party payer, there's a problem. It's interesting. Let me tell you what Savvos becomes for our health plan clients and our members and providers. If I'm uninsured and I walk into a surgical center and I say, look, I need shoulder surgery, what's your best cash price? It's a really simple conversation. But when I walk into the surgical center and I say, look, what's your best cash price? And just so you know, I have this third-party payer out there. Soon as you say that, it's like everybody starts speaking a foreign language. Nobody can figure out how to communicate with each other. And the surgical center is like, well, if I got to bill this third-party payer that I know nothing about and I don't have a contract with, and then I'm just going to give you my standard billing rate and you pay me and then you settle with them. And it becomes this kind of this healthcare dumpster fire. Savvos fixes all that. We become not just the data platform for members and their health plan. We become the end-to-end fintech platform for the entire transaction. When we engage a member within Savvos, once a member finds their price and they initiate a procedure, we bring them into the Savvos portal. And I'll show you central to Savvos is how we connect and create a single conversation for scheduling care, finalizing the price, approving payment, and settling and paying providers immediately. So you'll notice within our system, the member, which in this case is me, and the health plan are automatically connected with the facility, the surgeon, and anybody else that we want to pull into this conversation. Maybe we want to bundle in physical therapy, or we can pull in a physical therapist into the conversation. And central to our portal is the Savvos messaging system. Now, before we started, I just created I kind of got in there and just created a sample conversation, but the member and the health plan and the surgical center and their surgeon, they all communicate within the Savvos portal. It's one conversation to decide, okay, what exactly needs to be done? Is this approved by this health plan? When are we going to get this on the schedule? What's the final price? You'll notice here on the right-hand side, we take all these stakeholders through this workflow. We finalize the appointment, we finalize the price. And when I say we finalize the price, this is critical because there's a lot of platforms that just like dump data in front of consumers. But if I'm scheduling an ACL repair, if I'm scheduling CPT code 29888, 9 times out of 10, my ACL repair is never just an ACL repair. My surgeon's going to say, well, you tore your ACL, but it also looks like you tore your meniscus. It also looks like we've got some loose cartilage sitting under your kneecap. And so whenever the surgeon submits those orders for procedure, and you can see right in here, we can upload medical records, physician notes, order forms. Everybody's in the same conversation. But oftentimes, there's more to the surgery than just CPT code 29888. So within the Savvos platform, you can see right now, this isn't a cost pending status, but providers build out their custom price. Okay, you saw our price for the ACL, for all these other procedures. Here's what the total price is going to look like. And then everybody finalizes the cost. The health plan authorizes payment. And then about 3 to 5 days before the procedure, Savvos funds it. We pull funds from the health plan. And this really is the secret sauce to Savvos. When providers notice that this goes green and the procedure's funded, they move ahead and deliver care at their cash price because they know that as soon as they deliver care, they get paid immediately. And this relationship within Savvos has been not only incredibly successful, but I wish you could all see some of these conversations. It's almost emotional to see these members and their health plan and these stakeholders, these providers, all engaged in one conversation. We get members that call us up here at Savvos and they're like, guys, I've never had such a cool healthcare experience just trying to get my procedure scheduled and get everybody on the same page. At the beginning of this year, my son had a shoulder surgery. And he came to my house the night before the surgery, and he's an adult, he's in his mid-20s, and he's super successful. And he was almost in tears. He was like, Dad, he's like, I've been on the phone all day, calling the surgical center, calling my health plan, calling my doctor, trying to figure out what my surgery was going to cost and how much I was going to have to pay. And he's like, it's 5 o'clock at night. I'm having surgery in the morning. I still have no idea. And you guys, for 90% of your clients, that's the healthcare experience. And we need to do better. We need a better member experience. And with Savvos, we create one conversation where the health plan and the provider, the surgical center, the surgeon, the member, they finalize everything. When that member goes in for surgery, there's no surprises. So at the end of the day, the outcomes, the results, like what's the value of Savvos? Well, when we work with these health plans, they have tremendous incentive to help their members engage with cash pay settlement. So usually what that means is completely waiving member out-of-pocket costs. That may not have meant much 10 years ago when you had a $250 deductible. But when a family's sitting on a $2,500 deductible or a 5,000 IUA or whatever you call it with your plan, if a health plan can say, hey, if you'll redirect and go to this great facility and, right down the street, instead of going to where the surgeon's recommending, I'll waive your $5,000. You guys, that's a power that has such an impact at the family level when it comes to engaging in healthcare. So it's powerful. When you look at what's happening in this emerging market of alternative payers, if we don't help this market drive their members to affordable prices, in 5 years, they're going to be a dumpster fire like Blue Cross Blue Shield. They don't have a choice. If they're spending $120,000 on an ovarian cyst surgery when they could have spent $6,500, they can't keep their premiums, member fees, whatever, at these competitive rates. These health plans have to engage, and providers love it. Providers, they're desperately looking for a way to tap into this exploding market of cash pay. And Savvos, we create this scalable, repeatable transaction for providers. We help providers plug into dozens of payers, and yet they don't have to figure out how to work with any of them because they get paid through Savvos the same way every time. So our goal is to create immediate cash pay solutions for elective outpatient care. We're the new kids on the block, everyone. We launched this product January 3rd of this year, and we're taking this industry by storm. We've onboarded a number of payers. You would know the names, and we're in advanced conversations with a number of them that you would know the names. They love what we're doing. We're disrupting this transparency space and making a huge impact. And so I'm grateful and thank you for listening and appreciate Jim and Jeff for letting me tell the story. And with that, I'll stop sharing my screen and throw it back to Jim to see how bad I did, I guess.
Thank you, Lou. I'm ready to sign up. Okay, I'm sure we
Awesome.
have questions. I mean, my first one, and people, everybody, you can use the raise hand icon at the bottom of your screen if you'd like to ask a question. My first one is kind of the normal one you would ask. Well, why didn't your son come to you at first instead of dealing with, trying to work out the costs and everything? Because dad does that. Or was that a test or,
Yeah, great question. So my son had a health plan, a local health plan here in Utah. Savvos, we work predominantly through alternative payers, through health plans, and his health plan doesn't work with Savvos. So in terms of like creating that engagement and, so again, this is the problem in the legacy system, right? Like my son was with a local insurance company. So what does that mean? Cash pricing goes out the window. It's all about what's my contracted rate with whatever his plan was. It was like, I don't know why I'm drawing it, like Motive Health was his local health plan. So a conversation around cash pay settlement in a fully insured environment completely goes out the window. Now I'm more worried about staying in network. What's my deductible? We're having the wrong conversations in that market. So as much as I could tell them, hey, here's your cash price, but if you're going to run this through Motive Health, their contract's always going to govern. So I couldn't help him.
And so how do you approach payers? I mean, what's the, and your secret sauce? What do they love about what you're doing?
So the traditional payers like a Blue Cross or a United Healthcare, they're never really going to play ball with us. I don't think, their systems are built around contract pricing, in-network traffic, right? So we talk to this, like I said, this emerging market of new payers, right? Whether it's this creative insurance company or their health sharing groups, these organizations that are more member driven, they don't use traditional networks or contracts. If it's a third party payer that plays in that space, they'll work with us all day because what they need for their members are better tools and a better experience to drive those members to affordable prices. You can talk to these members all day and say, guys, look, we need you to get engaged. And they kind of throw up their hands. They're like, oh, what do you want us to do? We have no idea where to start. We have no idea how to find a competitive price. So they launched Savvos, and now their members can jump into our platform and say, oh my gosh, look at this price. The problem with the average consumer in this country, we've been led to believe that quality healthcare needs to ruin us financially. There's actually an inverse relationship between quality and cost, in my opinion. But talk to your average customer. They're like, oh my gosh, I need a total knee. Should I start declaring bankruptcy today or just wait till like the collections start, right? But that's the average consumer's perspective on healthcare. It's a complete fantasy. It's a complete con. The reality is if most consumers knew how affordable we can make their elective outpatient care with cash pricing, a lot of them would just choose to be uninsured. They could just pay their medical bills. Right now, across the country, you got people paying $30,000 a year in premium for a $10,000 deductible. They're paying a fortune for the privilege of paying all their healthcare costs anyway. I mean, it's insane what's happening in that market.
Yeah.
I got a quickie question for you there,
Yeah.
Lou. It's Jeff. One, do you work with employers or only with individuals?
We absolutely will work with employers. We don't typically market directly to employers. We have some affiliate relationships that are starting to plug Savvos into their employer sales efforts. But so we connect typically with the payer, whoever's releasing funds and authorizing payments. So if it's a self-funded employer group, then usually we would work at the TPA level with them or at the stop loss level with them and things like that. If it's a fully insured employer, with a kind of a legacy plan, I mean, they're not really going to work with us. We're not trying to pull anybody outside of their catastrophic coverage. So if they're like, well, we can work with Savvos, but you got to pay cash and not use your insurance, that's not really our market.
Okay.
That's very good.
Hey there.
Yeah.
It's Janice.
Yeah.
I did raise my hand.
Yeah, I see. There you go.
I love this solution, and I'm glad to be part of this community. I actually talked to your son yesterday. I have a company that's trying to just totally eliminate health insurance, and we create budgets for people because our view is if people just knew how much they had to spend, then why would they get insured except for anything catastrophic for all the reasons that we're familiar with. And we're not on the pricing side. You guys are on the pricing side. We're on more the utilization side, saying like, well, why do you need this? Or when should you have it? And but I'm always talking to folks like you who are, bringing these great prices to the fore. And having worked in the ambulatory surgery center environment for 6 or 8 years, like it's so much cheaper. So my question to you, because the prices are insane, is how does the consumer get access to this if their TPA or their insurer doesn't contract with you? And when you're getting these prices, are you posting them so that people who don't have access to Savvos can know what they are and do some negotiations on their own?
Well, those are great questions. And I would say that some of these solutions are coming. So like I mentioned a few minutes ago, we're a new startup in this space in terms of fintech solutions and really trying to get a foothold in the market. The challenge is launching a tech company direct to consumer off the ground is a recipe for disaster. It never works. So you've really got to go into more like enterprise level solutions with third-party payers and whatnot. What my original model 2 years ago was a direct-to-consumer model, and I realized pretty fast I'm gonna starve to death trying to get this story off the ground, right? And it's just the nature of like launching a startup in the tech space. You can't, there's a book out there called Crossing the Chasm, and you just can't do it direct to consumer. So our emphasis and focus right now is with more enterprise level solutions with the payers, because when we go and work with Zion Health, for example, we turn on 40,000 members tomorrow, right? It's a lot easier for us to push volume through our system than trying to figure out how to connect with one consumer at a time. But I would tell you it's coming. You may have been able to feel it in this conversation. I'm pretty passionate about what we're doing here, and I do want to bring this to consumers. Sometimes consumers are their own worst enemies. we've tried to find really creative ways to monetize Savvos where it's worth it for us financially. We're saving consumers a ton of money. But we just had one yesterday, without going into detail, it's a consumer that ended up being a self-pay through Savvos. It's not our typical model, but it just kind of happened. And he got real belligerent, like, wait, well, I'm not paying your fee, and the reality is he just spent $50,000 more on that surgery had he not scheduled that through Savvos. But our fee was like this ridiculous fee, this little fee was a huge hangup for him. So there's, in the third party payer space, the health plans and the health sharing plans, they'll pay us all day because we're saving them a fortune. Last month alone, we saved one of our health sharing partners that only ran 15 procedures through our portal last month. We saved them $300,000 on what they would have spent otherwise. With one of our health sharing partners, by the end of the year, we'll probably do 300 procedures and save them $2 to $3 million in what they would have spent in claims. So these third-party payers, they'll pay us all day long. Consumers, direct to consumer, it's a little more difficult. But I would say, to answer your question, yes, it's coming. We don't really have a product that we market direct to consumers today, but it sounds like we're in conversations with your company. And thanks for talking to us. Let's figure out a way to get something off the ground.
Yeah, for sure. I mean, and the hope would be that, because what you're doing, there are other people trying to do what you're doing, and it is a grassroots thing where everyone's, reaching out. Like you said, it is exploding. The hope then would be that when you save, an insurer, the TPA, whatever, the payer, $3.2 million, that they then turn around and lower the rates that they're charging everybody. They probably won't, but it would be good if they did.
Yeah, and that's the hope. The other challenge, this is going to sound a little negative, and I don't mean it to be, but in the traditional employer space, you got a lot of people fighting to remain relevant. You've got, in a shifting market, when we start talking to HR departments and TPAs, I have a very collaborative perspective on fixing healthcare, but a lot of when we go direct to employer and TPAs, they get very defensive, like, whoa, like I can see that you're going to put me out of a job in 6 months, and so it's a challenge. So when I go to the alternative emerging market, these guys are so fun to work with, and they're making such an impact in the employer space. And brokers, I love brokers. I always tell everybody I'm a recovering broker. My previous company, I had a large benefits division in my human capital management lifestyle. But sometimes brokers are your problem, like you got to kind of get them out of the way. I used to say it's only 95% of the brokers that give the rest of them a bad name, but you got to find the good ones that want to, have these kind of conversations, and let's work together to bring solutions to the employer space, because almost all the holy grails of benefit offerings are gone, right? Government agencies, municipalities, school districts, everybody used to go to work for them because they had these zero deductible health plans. And now they're all on $5,000 deductible plans. Like nobody can hang on anymore. Even the big tech giants, their employees are like, all of a sudden I got a $2,000 deductible. What does that mean? So it's
right.
a shifting
They're all
market.
slipping off. You
got to figure it out.
Yeah. But and last comment is, you have a great opportunity. There's so many insurtech companies that are doing redefining plans for small businesses. I'm sure you're talking to all of them because they would love to work with you.
Oh yeah. Yeah. And they're all talking to us.
Yeah.
Like I said, we've been doing this for 6 months, and it's been really fun playing in this space. Yes. And let's keep talking, Janice.
Yeah.
We'll work together for sure. We'll find a way.
Yeah. All right. Awesome. Thank you, guys.
Thank you.
Thank you. So how are you marketing, Lou? What are you guys, what are you doing? What are you planning to do to expand into some of these markets and areas Janice was talking about?
Yeah, well, right now our marketing efforts center around third-party payer solutions, right? So we spend a lot of time at conferences across the country, and a lot of outreach where, we're in active negotiations with the majority of the health sharing plans out there. A lot of these new insurance companies that are showing up on the scene that are outside of traditional networks and whatnot. we reach out to them, and we're in active conversations with a number of them. Captives, they really like what we're doing. Captive insurance solutions in the employer space are looking for, better solutions to drive that no out-of-pocket cost for elective outpatient care story. So they like what we bring to the table, and we're in active. We've launched our first captive relationship already, and we're in active conversations with a few others in that space. We have some terrific collaborative relationships that are opening doors to direct to employer sales, stop loss sales, the TPA marketplace. And as we finalize contracts with them, you'll see some of that come out. And so we're doing it's really just an aggressive biz dev outreach campaign out of Savvos. We are not doing a lot of direct to consumer marketing today.
Sure.
So what we're basically telling consumers is, hey, look, we've aligned our system with these health sharing plans and these other creative insurance plans. Go talk to your provider, your health plan payer. And if they don't use Savvos, ask him to take a look at us. Like, that's really been our conversation with consumers, is help us get our foot in the door with your payer, and then you can start to benefit from what Savvos is doing.
Are you mostly local right now, like in Utah?
No,
Or-
we provide services in all 50 states. Now, certainly there's about 20 states that we're getting really strong in. When you look at like this movement towards this alternative space, I mean, there's not a lot going on in New Hampshire or Vermont, but kind of along the way in the West, Colorado, Utah, Arizona, Texas. You're seeing a lot in the South, Oklahoma. Is Oklahoma the South? Feels like the South. Florida, places like that. You're seeing a lot of activity, and all of you probably see it in terms of like your sales with some of these creative products. We don't see as much in I don't see a lot in the Northeast, and of course, like in the the northern part of the U.S., there's just not a lot of population up there, so we don't do a ton of business, but we can deliver solutions everywhere. What's unique about Savvos is we add new providers and their cash pricing to our platform every day, but we can also add providers kind of on the fly, so to speak. We'll have one of our payers that'll get in the platform and say, hey, I need an ovarian cyst surgery in Tallahassee, Florida, but I can't find a solution in your platform. And we'll say, okay, well, give us 48 hours and we'll just turn our outreach team on to Tallahassee and we'll find a new provider. Providers don't pay us a dime to list their prices and to engage within Savvos. Providers absolutely love working with Savvos. In fact, I would add to that, these health plans don't pay us a dime unless they use Savvos. We don't charge a PEPM fee. There's no minimum monthly fees. We're a transaction-based model. So if we can't deliver better pricing to your members, we don't make anything. And so these health plans love us. We're a no-risk proposition to launch Savvos with their members.
When, so you guys just started in January. Who was behind the company? I mean, how was it capitalized? I'm curious from a business standpoint.
Yeah, great question. I'm still the largest single investor in Savvos, and my business partner, the two of us who founded the company, he's, I would guess, the second largest investor. We have had in the early days. So we launched this product and this focus January 3rd. Prior to January, we were trying to figure out how to get this story off the ground. We had launched kind of this direct-to-consumer data platform. So we were at it for a couple of years before we sort of got the model right. But over the last 2.5 years, we had a couple of initial angel investors. The end of last year, we did a pre-seed round that as we pivoted into enterprise solutions and what we're doing now, the interest just wouldn't stop. So that was a really successful round that we just recently closed, and we're really happy with how that turned out. So we're very well capitalized. The summer months were a little slow. I mean, if you hurt your shoulder and you need surgery, you're probably not going to schedule it in July and ruin your family vacation or your trip to the lake or whatnot. So So in elective outpatient care, a lot of that gets kicked into August and September. But we've been a tech startup for the last 2.5 years. This month of August, it looks like where we transition, where we're break even and cash flow positive. So we've that's quite a milestone for us. And if anybody's been in the tech startup world, you know it's a very capital intensive process. It just takes time and it takes money. And we've been doing that for the last 2.5 years. But this is a really exciting year for us because now we're moving into pretty aggressive revenues, and we're really out of that proof of concept model. Now we're just trying to go big.
Nice. I'm curious, how many you have on staff now?
We're a small company. We got about a dozen employees right now, but we had 10. We just hired 2. In fact, we're just kind of drowning, getting these new team members trained. And I imagine if we keep seeing our numbers grow the way they are, we'll probably have about 25 employees by the end of the year.
Yeah. Any fun other stories you could share? Horror stories? I mean, not for you, but other people, or where you guys might have helped out?
Yeah, I could talk to you. I could talk to this group for hours. It's interesting. Like you go to the conferences and you listen to these stories and everyone's just aghast, like, oh my gosh, what's happening in healthcare? But when you get in the middle of it, it is like sweat's dripping down your face. You're getting angry. I mean, it's like when you're in the front lines throwing punches, so to speak, it's insane how emotional it gets. One of our very first procedures was a heart bypass surgery, an open heart surgery. Now you wouldn't think of that as elective outpatient care, and it's not. It's inpatient about 5 days, but it's actually become a very common shoppable procedure, open heart surgery. Isn't that crazy? I would have never thought. So the member was connecting through Savvos, and you wouldn't believe this. The local hospital, number one, they were a disaster to work with. I could pay 2 people to be on the phone all day to try to have one conversation with somebody at that hospital. It's insane. The way that these hospitals respond to consumers, it ought to be criminal. There should be criminal charges levied against these executives and their employees that are letting people die at home because nobody answers the phone. It infuriates me. But so we finally reached out to this hospital for this heart surgery where the member, their surgeon was recommending that they have the procedure. And the facility was like, well, it's a $240,000 surgery. And it was, okay, well, let's start talking about, like, can we get a better price? And finally they're like, well, we'll discount it to 150, but you got to pay it all up front, you know? And we started looking around, and 2 hours away, we found this amazing center of excellence for heart surgery. And their cash price, $33,000. So I called the hospital back, and I got this woman, I think her name was Sherry. And I was like, Sherry, first of all, your organization is a disaster to work with. So you just need to know that. Second of all, you're at $150,000 for a surgery that 2 hours away, a much better facility will do it for 33. I wasn't very diplomatic, to be honest, and I'm a little embarrassed about that. And she was indignant. She was like, this patient should be grateful. We discounted our price from $240 to $150. And I was like, Sherry, do me a favor. Why don't you match the $33,000? We'll get the patient scheduled at your facility. Let's get this patient taken care of. And I'm not kidding. This is exactly what she said was, we don't even want this patient anymore. Take them somewhere else. Bam, hangs up the phone. That's your local hospital, folks. Can you believe that? Here we got this guy sitting at home. His wife's in our portal every day. Hey guys, I'm really worried about my husband. Are we going to get this scheduled? I mean, it was like emotional. And we got this hospital's like, we're not even going to touch this guy until you agree to pay us $150,000. Isn't that insane?
Yeah, well, living outside of Washington, D.C., and I don't know what it's like in the rest of the country, but service, whether you're at a restaurant or you walk into a store, it's just kind of completely gone. People don't care. Go somewhere else. We don't care. Anyway.
But in healthcare, I was just talking to my father yesterday, and he said, you know, your mother called her medical clinic. This was like 2 days ago. He said, you know, she was on hold for 3 hours, and I finally put her in the car and we drove down there to talk to somebody. Guys, they're literally, I mean, when it comes to, there's very few things that are as intimate as personal in terms of like a business product than healthcare. In my previous life, I was payroll and employee benefits. We were a human capital management firm. And I used to say the two most emotional things that you're ever going to deal with somebody is going to be centered around their money or their health. And that's just the reality. And yet we treat people like garbage when they're at their most vulnerable spot. Like, I think I'm going to die. I need help. Oh yeah, I'm not going to answer the phone. Like this behavior should be criminal.
Yeah, let me jump in. We have maybe 10 minutes left or 9. Linda, you have a question? And I know, George, I'm glad you turned your screen on because I probably would have said, I know you're in the field. What do you want to say? A comment. So Linda, go and start with you.
Yeah, the problem is, I agree with all your comments, but the crime starts from when the insurance company, health insurance company, bought the hospitals. And I have terrible examples here in Baltimore. Union Memorial Hospital, for instance, used to be excellent, better than Johns Hopkins University Hospital. But then they fired all the best doctors, they closed units. And recently I had a terrible issue with my son to go to the emergency room, calling 911. First, firefighters came instead of paramedics. I have then to call again for ambulance. They told me we are short of staff of ambulances. My son was bleeding, screaming, terrible condition. And at the emergency room, finally, at the Union Memorial Hospital, for 1 hour, no doctor showed up at all. So those are things I consider crimes against health and against humanity. So how we can stop all that? And 2 days ago, we went to another hospital for a second examination, also which belongs to MedStar, because they bought 10 hospitals. And also there, after 2 other hospitals, they could not find a real surgeon knowledge about GI problems. That's the story.
Thank you, Linda.
And yeah, and like I said at the beginning, this is a big problem, right? Like
huge, a crime against the health system of Americans, against humanity. Where are we going?
Yeah, and you see it at every level, right? I mean, remember a few years ago,
Every level,
at every scandal with the VA and all these veterans that were dying because they
exactly.
Yeah, it's like, this is a shame that we're having these problems, that my 79-year-old parents have to get in the car and drive to the doctor because nobody will answer the phone.
Yeah,
that's
the
criminal.
All right,
you
thank
know,
you.
I complained to the police department, and why you send the firefighters and not ambulance? And they said, we are short of ambulances and personnel, paramedics. That was the explanation they gave me. Anyway.
All right. Let me thank you. George, sticking to topic, what do you got?
Hey, Lou. Thanks, Jim. Lou, how you doing? Pleasure to meet. I love what you guys are doing. Yeah, no, the first comment, one of the first comments you made today when you said you asked some brokers, what do they do for their own families? You know, I bring that topic up in meetings with C-suites all the time. I said, nobody ever asked me what I do. You know, I pay for, you know, I have health sharing, I have direct primary care, and we shop for other things. And, you know, there's more and more tools available now out there to become a more healthcare savvy kind of person. But it's that mindset. You need that mindset. If you think I'm paying Blue Cross $2,500 a month for my family plan, I deserve everything, it's never going to work out well for you in that scenario. Just on what Linda was touching on just now, if our system keeps treating doctors and nurses, you know, people with their boots on the ground who work in healthcare, the way they do now, there's never going to be any improvements. They're burned out. There's not enough of them, and it's really a terrible career path to follow. And everybody's lying to them. I mean, from the universities all the way through till they start their employment. That's when really the veil is lifted and they realize, oh my goodness, I'm working in hell. And then they try to find some way to be independent. And that's very doable. I think there's a lot of opportunities out there right now for, let's call them providers. I don't like to use that word when we talk about doctors and nurses, but if they want to do business direct with consumers. And when you cut out these insurance companies, the BUCAs, you can actually focus on, employers, for example, can focus on providing healthcare. And I work with self-funded plans, and anything that works is welcome in our space.
I love it. Yeah, and I absolutely agree. I think as we start looking at like where we need to focus our time and attention and efforts and whatnot, I think anything we can do to pull activity away from traditional plans. It's funny. I was just saying in closing, Linda and George, you both kind of touched on like the insurance being at kind of the heart of some of our issues. One of the main provisions of the Affordable Care Act was capping insurance companies' profit margins. 15 to 20% of every dollar they collect can only be kept as profit or to cover admin costs. The rest has to be paid in claims. And when that was passed, everybody sort of cheered and said, "Oh, great, that's a great win for consumers." The reality is in an environment like that, insurance companies can only make money in two ways: add more members or watch their claim costs go up extraordinarily high. And if you go look at hospital revenue since the passage of the Affordable Care Act till today, you'll notice that hospital revenue across any system has exploded. It's the only way for insurance companies to make more money. 15% of $3,000 a month is way more money than 15% of $700. So people don't get that principle, and that's one of the reasons why insurance is really at the heart of a lot of the problems we're dealing with this cost issue. So drive them out of that market, man.
Yeah. Okay, to wrap up, Lou, how can people find you, reach you?
Yeah,
Help
go to
you.
Savvos, go to our website, savvos.com. It's easy to connect with us there. I think I don't know if my contact info is in the bio, will be on your site, but you're welcome to call me. You can call me on my cell phone, reach out to me anytime. We have a very collaborative approach when it comes to trying to solve some of these issues in healthcare. And as a young startup, we are hungry to work with anybody that's playing in this space. You'll feel a real impact in whatever market you're playing in if you align with Savvos. We're making a huge difference. So anybody who listens to this, if you want to reach out, we'd love to talk to you and see if we can build a relationship.
So what about your wealth? If your money could actually talk to you, would you listen to it? Well, with the DNA Network Academy, your money actually can talk to you. And it's going to tell you just what it told this client. This family had over 24 debts, mortgages, car loans, the works. They were on track to take 20 years to pay it all off and instead did it in 8.5. Plus, they did it without refinancing, making more money, or even changing their lifestyle. So find out for yourself with a free analysis that is completely confidential. No personal information, no social security numbers, no credit checks, none of that nonsense. But what is exciting is that the outcome of that report you receive is a guaranteed outcome for you. To get that report, head on over to bit.ly/debt to wealth. You will arrive at this simple form. Fill it in as simple as lender number 1 and credit card number 2. What really matters is the accuracy of your numbers. You'll be able to see that if instead of 20 years or whatever your number is, that you may actually be out of debt and on your way to wealth in as little as 6.3 years like this client.